Production.
We have vitamin D. Vitamin D comes in two forms. It's going to be your ergocalciferol, which is what's the form is going to be in your prescription drugs. Then you have type D3, which is cholecalciferol, which is the type that your body makes when UV light hits the skin. Type 2 is the best way to take in vitamin D because it's vegan and it's going to be the best way to tell if your deficiency comes from malabsorption.
Common forms of vitamin D2 are from fortified soy milk and almond milk, along with irradiating mushrooms and yeast from exposure to sunlight. Vitamin D3 is common in fortified milk, yogurt, and orange juice, and then it's naturally found in cod liver oil, oily fish like salmon and trout, egg yolks, beef liver, and then you can also get it from just exposure to sunlight. Vitamin D supplements should be taken with a meal-containing fat to increase its absorption. Individuals should take in 600 IUs or 15 micrograms if they're between the ages of 1 and 70, and if they're over 70, they should take in 800 IUs.
So the processes which vitamin D is used in, so muscle contraction. So one of its main uses is it regulates calcium transport and uptake of inorganic phosphate, especially in type 2 muscle fibers. So vitamin D deficiency therefore leads to weak type 2 muscle fibers, impaired muscle contractions and relaxations, decreased strength, and a potential decline in athletic ability and performance. Higher serum levels are also associated with increased levels in muscle strength. But overall, it promotes calcium absorption in the gut, maintains blood calcium and phosphorus levels, reduces inflammation, important physiological effects on cell growth, muscle, and immune function.
There's been a lot of research being done about involvement of vitamin D in cancer management. One study went through and took 18 other studies and looked at the results, and pretty much what they found was that in a large number of breast cancer survivors, those that took in vitamin D had better outcomes. There were also skewed results on whether or not it helped with other types of cancers. So the researchers called for more research on those other types and also about what doses would work best for which patients.
These words. Research has also looked at vitamin D's effect on sleep. This study aimed at determining the effect of vitamin D supplements on sleep in aged 20 to 50-year-olds. So this study was a double-blind clinical trial. It was performed on 89 people with sleep disorders based on the Petersburg Sleep Index. Patient samples were divided into the intervention group and placebo group. So at the end of the study, the data on the 89 subjects, there was 44 in the intervention group and 45 in the placebo group were examined. So the intervention group received 50,000 unit vitamin D supplement once every 2 weeks for 8 weeks, and obviously the placebo group had a placebo. Before and after intervention, they assessed the subjects by the Petersburg Sleep Quality Questionnaire, and then they also assessed them with the International Physical Activity Questionnaire, a general information questionnaire, and then they took into account sun exposure, vitamin D, serum levels, and also a 3-day food record questionnaire. So at the end of the study, they found that vitamin D supplement definitely does improve sleep quality, reduces sleep latency, raises sleep duration, and improves subject sleep quality in people's aged 20 to 50 years old with sleep disorders.
Another study looked at the effects of vitamin D supplementation on first-time mothers with postpartum depression and fatigue. Of the 80 women, 40 women were given 1,000 IUs of vitamin D3 every day for 6 months. The other 40 women were given a placebo pill. The results showed that vitamin D decreased depression and fatigue symptoms in the women that received the supplementation.
Oh, okay.
So researchers did an experiment to test the vitamin D levels in children with ADHD and those without it. So they took 60 children between the ages of 6 and 12 and tested their vitamin D levels, the vitamin D receptors, their calcium, phosphorus, and alkaline phosphatase levels. What they found was that the children with ADHD were significantly lower in the vitamin D and vitamin D receptors. They also didn't have any differences in the other things tested. And the last thing they found was that within all the kids with ADHD, they were all low in vitamin D.
Individuals at risk for a deficiency or an inadequacy of vitamin D include individuals who consume a diet consistently low in vitamin D, elderly because old age tends to decrease the synthesis of vitamin D from sunlight, anyone who has low exposure to sunlight and has excessive sunblock use, dark-skinned individuals because a higher melanin content reduces the body's ability to synthesize vitamin D from sunlight, obese individuals because fat absorbs vitamin D and limits its release into the blood, anyone who had gastric bypass surgery because it decreases the chance for absorption in the small intestine, and then breastfeeding infants because breast milk is a poor source of vitamin D. Signs and symptoms of a deficiency include softening of the bones or osteomalacia, which leads to weak bones and weak muscles. In children, a deficiency can show in a disease called rickets, which leads to poor bone mineralization and skeletal deformities. A vitamin D deficiency can lead to decreased phosphorus and calcium absorption, which can contribute to osteoporosis.
Soft tissue calcifications. Conditions leading to toxicity. So two things will do that: continuous supplementation and then prescription intake of vitamin D. So this leads to hypercalcemia, hypercalciuria, kidney stones, and also soft tissue calcifications. So some facts that are not in the book that are pretty interesting. Increased levels of vitamin D have been associated with decreased levels of visceral fat, so that's pretty cool. Also, chances of vitamin D deficiency are increased in non-summer months at latitude lines above 37 degrees in North America, and this is due to the exposure of sunlight. So that's